Welcome to Mind Beyond the Mission, a podcast for and by veterans and veteran family members. I'm one of your hosts, Brian McKenna, and I'm a strategic advisor at the Atlas Institute and a retired Canadian soldier.
And I'm Laryssa Lamrock, strategic advisor at the Atlas Institute and a proud military family member. In this podcast, we'll be diving into real issues experienced by veterans, former RCMP members, and their families.
We won't promise you that we'll do everything perfectly, but we can assure you that we'll be getting real about the experiences that so many of us have in common, but don't always talk about, or don't necessarily know where or how to talk about it.
We hope you'll find solidarity in our words and experiences, and most importantly, that you'll find a sense of hope that things can truly get better. You can live present in the moment and live life authentically.
Let's get into it.
So here we are again, recording another podcast episode, which I'm pretty excited about, where you and I are in person this time, Brian, which is always good.
And I don't have to talk about relationships today.
That's right. Well, you never know where this is going to go. Before we get started with today's episode, what I do want to say is we're starting to get some feedback from listeners through email and just personal conversations, and we really appreciate that because it lets us know that we're on the right track, that we're talking about things that resonate with the community, with people who work with the veteran and family community. And I think I just want to ask, if you're listening to the episodes and you're appreciating them, let us know. So even on whatever platform you're listening, hit like, put in a comment to start a conversation, because I think by the more that you do that, it'll eventually start to reach more veterans and families who might find interest in the episodes. So we're hoping you'll hit the like button.
So we got one of our specialists here with us today, Dr. Andrew Nicholson. And, you know, sometimes I get a laugh when I look at folks like him. You know, I think back to myself being 5, roaming around the playground like I want to be a police officer. My buddy wants to be a fireman. And there's Andrew. I want to measure the responses of the amygdala. You know, like, how do you get into the job that you're in? And when did you know you wanted to work in that kind of field?
Yeah, that's a great question. Well, first of all, thank you for inviting me to the podcast. I'm really excited to be here this morning. Yeah, I think actually, when I was a kid, I wanted to be a chef, actually.
All right.
I loved cooking. I loved the social component of that and cooking for my family. I'm the youngest of 4. I loved that. And then I was really interested in biology and medicine. And I think when I went into university, you know, those were kind of the only options I really knew of, you know, medicine, going to medical school, or, you know, being a biologist and being a scientist kind of thing. And then when I was at Western University, I was introduced to more the field of psychiatry and neuroimaging through a couple of classes there when I started working with Ruth Lanius at Western University. And it was so exciting because we, to be frank, don't know that much about the brain and how mental illness can manifest and how we can actually, more importantly, help people heal and treat people with mental health conditions, right? So it was a very exciting, I think, field to go into. And when I started, I was surprised at how much meaning I derived from that work, because you can really see the benefits of your research and how it helps people. And I just think it feels like a hobby as well. I enjoy it every day, and I'm excited to go to work every day, which, yeah, it's a good sign.
So 5 years ago, I didn't know what neurofeedback is, and all I know about it is by asking you. And I think that, but to some degree, that's kind of the strength of our institute. Like, that's what we wanted, right? We wanted to bring in people with talent and then have veterans and family members be able to show them what we know and blend the two and get stuff done. But a lot of people out there probably be Googling right now trying to figure out what it is. So help them out. What's the shortest definition you could give that people could take out of this?
Yeah, so neurofeedback, just taking, one step back, we know that the brain has adaptive shifts when exposed to things like trauma, right? So it's adaptive for certain areas of the brain to become very hyperactive for these fight or flight responses, and for maybe the more cognitive, rational, parts of the brain to be shut down, because when you're under threat, you don't have 5 seconds to think about something. You need to make a quick decision, and the more reptilian brain structures, we call them, so the deeper brain structures that are really concerned with fight or flight and survival, are coming online. And sometimes in the aftermath of trauma, in the context of PTSD, people can get stuck in that hypervigilant state. And we know the brain is capable of healing itself and moving towards a state of psychological safety if just given the right stimuli. And this is what we try to do with neurofeedback. So as I mentioned, we know some areas of the brain are showing either too much or too little activity. So we measure those brain responses in real time with different neuroimaging methods. And we present that to people as either a visual display. This can be a gaming interface kind of thing, like a video game for your brain kind of thing, or it can be an auditory stimuli. But the point is, people try to learn strategies that work best for them to control that signal and either decrease or increase activity in certain regions.
So when we spoke earlier, you mentioned, I was expecting to hear that, there can be hyperactivity. Obviously, I think for myself, what I look back at as being the appropriate level of awareness in a rough place is no longer the right amount of awareness if I'm in Surrey or Ottawa. But that's what's going on. I was a little shocked to hear, though, that sometimes your work shows that people are hypo. They're not having what we would consider the right amount or to that effect. I wasn't expecting to hear that. How common is it?
Yeah, so it's interesting because I think this speaks to some of the difficulties in treating post-traumatic stress disorder, because we know it's so heterogeneous. There's many different ways someone can present with PTSD, over 600,000 different ways based on DSM-5. But that's very kind of micro, but on a more macro level, we have even just two different subtypes of PTSD, dissociative subtype and the more classic presentation. And what you mentioned now, this hypoactivation and kind of a shutdown of emotion centers, this is more the dissociative subtype. And people who develop this subtype of PTSD are more likely to have more chronic trauma exposure earlier in life, childhood trauma. It's more common among males as well. So this is where, instead of this hypervigilant fight or flight kind of hyperarousal response, dissociative subtype also has this emotional shutdown, emotional numbing, things like depersonalization, where someone becomes disconnected from their body, or derealization, where they feel like their environment is dreamlike or unreal. So this is kind of that shutdown of emotion centers that we see actually in the brain. And it's related to the emotion regulation areas of the brain coming online too much and really shutting down the emotion centers.
When we were prepping for the podcast, I know for myself, there's a couple of goals I'm hoping to achieve here. Number one, I said to you, is that you've broken every stereotype of a researcher that I had. And you even mentioned it a bit in your introduction about wanting to improve outcomes for people. Like a lot of what you're talking about was altruistic. So I just wanted people to understand that, particularly when we're talking to veterans and families who I think know so little about research and researchers. The other thing I think I'd like veterans and families to understand is there seems to be more acceptance for physical ailments that happen below the neck. So, you're talking a little bit with neurofeedback almost about the brain regenerating or rewiring in some ways. When people are talking about the brain rewiring or the neuroplasticity, and the fact that it can be measured and observed through neurofeedback is kind of exciting for me, because I'm hoping people will lessen the stigma and be interested in treatments such as neurofeedback and the type of work that you do as well. So.
Yeah. So I think actually our neurofeedback studies, a lot of patients who have participated in that clinical trial actually report that, that study gave them a lot of hope, because the brain is plastic and it is capable of healing itself through different treatment interventions, particularly when they're neurobiologically informed, I think. A couple of points I wanted to touch on. I think, neuroimaging particularly, I think is a great tool to help expose those invisible wounds that, can be post-traumatic stress disorder. Some people maybe want to participate in our neuroimaging studies. When they first get in contact with us, we're building trust, and it can be seen as maybe a stigmatizing thing of studying someone's brain in the context of mental illness, But actually, when we have a further discussion with participants and when they participate in our studies, they actually find the opposite. And it can be quite validating, I think. Participants are it's quite humbling and, really, really nice to see that a lot of our participants are extremely motivated to participate in our study. They find it's very important for them to be able to contribute and help other people who are suffering from something similar, especially when many of our clients, have tried many different treatments and they're hasn't worked for them, unfortunately. So they feel really strongly about that. Ailments below the neck have somehow more, people see that as more valid kind of thing. And through neuroimaging, I think we can, and by studying the brain, we could help reduce stigma of mental illness and better understand it. But then the third component is actually, especially in PTSD, it's not just about the brain and the mind, it's the brain, mind, body connection. And that's what we're also expanding on in a couple of our new treatment interventions, is incorporating bottom-up approaches to treatment and how can we regulate someone in their body and help people re-inhabit their body in the aftermath of trauma.
One of the things that I find promising is I think a lot of this work can kind of change stigma from a different point of view, the self-stigmatizing side of it, right? I know for me and a lot of other folks I've talked to, when you first hear about mental health, you think you're going to be in a room on an oversized couch, bunch of weird plants, and some guy asking you to talk to you about your feelings. And while that has its role, it gives this idea that it's not measurable, it's all subjective, it's just, something you can't put your finger on. Yet there we were the other day, and I'm wearing some of the equipment that Atlas is invested in, and I'm watching on the screen, and I'm not going to pretend to know what the lights mean and what the graph means, but lights and graphs means you're measuring something. There is something measurable here. And I don't know if everyone in the community knows that, because I certainly didn't.
Well, it makes it less invisible. Like, that's what you were saying about people feeling validated. Well, theoretically, I'm thinking if you can look at it, it actually is kind of visible and it validates that experience more. And I think you were kind of, Brian, where you were going the other day was like, if you had the equipment on Brian, Andrew, as an example, and Brian was triggered or stimulated by whatever thing, an image or something that you provide, without him telling you, can you see that?
It's also related to what you just said about neck down, right? Like, torn ligament shows up, broken fibula shows up. We've got the scales in the way of measuring that. I think there's a belief that everything above the neck is just arbitrary, just an idea or a feeling. And I think people might actually take something out of going, okay, this is being measured. One of the other things that we talked about after speaking to you last is when you're talking and you're explaining these processes to me, I'm thinking of a completely other form of therapy than you are. One of the things you're explaining is, well, we're going to measure, and then we're going to see how you react, and then we're going to see if we can kind of get the person's mind back to center in a self-controlled way. And I hear equine therapy. I hear the dog program. When you speak to people that have gone into those kinds of programs, the handlers will tell you, till the horse accepts you, this ain't progressing. So the horse makes you get back to center. Dog handlers, vets with dogs, they've said exactly the same as like, the dog knows there's a problem before I do, tells me there's a problem, I get myself back to center, I carry on with my day. So I'm always intrigued by that. It's like, I hear the science side of it, and then I wonder, well, from the layman's point of view, it sounds to me like we kind of do this in other ways. Is there a chance that dogs and horses are the first, neurofeedback machines?
I love that analogy, actually. Wow. I might use that moving forward. Yeah, I think in the end, it's about emotional regulation, right? It's about grounding someone, allowing them to be present in their body. The thing with neurofeedback is why I think this may be a promising adjunctive treatment for PTSD is the flexibility. So you can do neurofeedback by itself. People can just try to regulate certain areas of their brain while they're in a resting state, which means they're just seated comfortably. You could also pair that with exposure kind of based interventions, so prolonged exposure, where you may present trauma reminders to a person and then they try to regulate certain areas of their brain. Additionally, we are doing a clinical trial right now where people do neurofeedback right before a talk therapy session as a way to resource someone, get someone in kind of a ideal frame of mind before engaging in that talk therapy. Because we know some of the barriers to effectively engaging in cognitive-based therapies is if someone's too anxious, dissociated, or dysregulated. So really just getting someone into an optimal state before engaging in certain talk therapy. And that's what your example kind of reminds me of, actually, because we have, for example, canine-assisted psychotherapy. And it's kind of similar in that way. It's just resourcing, allowing someone to be, or scaffolding maybe someone to effectively engage in other therapies. Where I see it as a bit different is neurofeedback could also be standalone for some people. But, I say standalone with air quotes because I think neurofeedback is always important to pair that with a good psychotherapist, right? Because as you're regulating and kind of recalibrating some brain networks, things come to the surface that need to be processed for sure. So I just want to highlight that as well.
So one of the things that works for me in the world of grounding is I'm a West Coast guy. I love barbecuing. So I actually had a while, my doctor had me carrying around a small sandwich bag with a wet piece of cedar in it, because that reminds me of, smoking salmon. So imagine I'm working with you, or probably the other way around. I'm the patient and you're conducting, your work on me here. And we create a situation where I'm going to be stressed out. Say I looked at an image from my past that's bothersome. And then I bring out my cedar and I start smelling it. Would you actually be able to see me getting better? Is that something that you'd be able to notice? And would you notice it in real time?
Yes, absolutely. I think we see in the brain when someone is triggered by their trauma, those reptilian brain structures in the brainstem. So they're coming online. These are the fight or flight. They're just concerned with survival, right? And the amygdala as well. This is kind of that emotion hub, I guess, one of the hubs of the brain coming online. And then some of the more evolutionarily recent, let's say, brain areas in the cortex, those are going to decrease in activity, actually. And those are also the emotion regulation centers. This is where we're really having deep thought, I would say, or cognitive thoughts.
Rational and logical.
Yeah, exactly. Yeah, that's what I'm trying to say. Okay. So that would kind of decrease. And then probably as you're grounding yourself and using this strategy, it's going to be opposite.
We've been talking to you a little bit as a neurofeedback specialist, if I can call you that. But maybe we can talk a little bit more specifically about research. So what chose you to do research in the particular field of mental health, but also veterans and families?
Why do you like us?
Yeah, as I mentioned before, I started kind of my journey at Western University in London, Ontario. For me, it's really important having a job, a career that's meaningful and I'm helping people. And this is kind of why I want to go into medicine. And then as I mentioned, kind of gone to research at Western. And during my PhD, I started working with Ruth Lanius at Western University. And for anyone who knows Ruth or has met her, her energy is very contagious. She's super passionate. Yeah, so I started working with her and I loved neuroimaging and developing new treatments for psychiatric disorders. As I mentioned before, we just have so far to go.
Okay.
And there's so much to discover. It's really exciting to be in that field, and it's also really rewarding, both from helping individuals with mental illness, but also from a mentorship perspective. So mentoring, the grad students I work with and other trainees. During my PhD, Ruth is primarily a PTSD trauma researcher. So that's how I kind of got into that field. And PTSD, I would say, is unique in the sense of how, as I mentioned before, how heterogeneous this disorder is, right? So you never have just PTSD in real life, right? It's often common to have depressive symptoms or anxiety, sometimes substance use, sometimes sleep issues, chronic pain as well, a lot of that psychosomatic type of
intestinal stuff.
Yes, GI.
That was my
stuff.
history.
Yeah, exactly. Yeah, so PTSD is so complex, and it's of course very, very difficult to treat. And I think because of that, though, I don't know. There's so much meaning behind this work, right?
Well, one of the things that came up when we were chatting the other day, I see stigma in a whole lot of different places. And one is sometimes the Canadian Forces as a whole get stigmatized. But actually, you mentioned they're one of the first consumers of this work, right? And so how did that actually come about? Because a lot of people, there is sometimes an image of the military as like resisting this stuff.
Yeah.
But you're saying to me the other day, no, like they're at the front trying to get more of it.
My experience has been the Canadian military has actually really catalyzed and enabled some really exciting emerging research and treatment interventions. For example, things like neurofeedback. So we did proof of concept pilot studies, 10 years ago with support from the Canadian military. And that whole research program just kind of expanded since then. And we recently, a couple of years ago, did a clinical trial in neurofeedback as well. And we're continuing that work with Atlas.
Well, for me as a family member supporting someone with PTSD, that's so exciting in that there's promise and there's hope in kind of treatment and intervention, and people not, hopefully in the future, not struggling kind of as long. And maybe I'm sort of answering my own question. I don't mean to do that, but I want to ask you, why is research important? Because for me, until I came to Atlas, I didn't have a heck of a lot of interest in research. And like I said, I had a picture in my mind and thought, there's people in cubicles doing this, and then they publish a report and it sits on a shelf. But it's not that. And so, why is research important?
With that, like I hear a lot from the community saying enough research, just go do things. But you opened up here by saying, we don't know all that much about what's going on. Like we know a fair amount, but there's still tons to do.
Yeah. Research is important because, again, PTSD is so complex if we're talking about that, but, mental health conditions in general, there's a far way to go in terms of better understanding the risk factors for how these symptoms may come about, how these conditions can manifest both in the brain and the body, and then also how do we go about helping to intervene and treat those symptoms, and how do we leverage resiliency factors as well. So I think there's so far to go, and I think a lot of our clients we work with, they recognize that and they feel that, especially when, unfortunately, some people we work with can feel actually quite discouraged about their experience so far in a treatment setting. And that's why it's so important for them and meaningful for them to contribute to our research. And then the second component to my answer would be actually why I think Atlas is such an exciting place to work. So previously, I was a researcher and professor at McMaster University. And then last year, I moved to the University of Ottawa, and I'm working as the director of clinical research at Atlas. And it's been such a different experience and such a positive experience because typically, researchers are kind of siloed, right? And you mentioned before, they're publishing, and it's sitting on a shelf.
Right.
And I think that's what's so unique about Atlas is that we have our research teams, we have the knowledge mobilization and translation teams, who work with the research teams to really get that information out there in other avenues besides publications in scientific journals, right? So making sure that information is accessible, available, and really reaching the people who it needs to reach. Additionally, the lived experience team at Atlas as well is so unique.
Yeah, they are.
Tell us more. I was going to say, this has been a paid promotion.
Go on.
But the ecosystem Atlas has set up too, in terms of lived experience, helping or collaborating and co-creating projects and deciding what's really the question we should be asking. Or when the research is done, how do we leverage this and how do we get it to the people
how do we give
need
it legs,
to? Yeah.
Right.
For example, some of our studies in neurofeedback were published earlier this year. This is just one example. Mm-hmm. And, this is what we do typically. A clinical trial wraps up. We publish it in a scientific journal. With the help of the communications team and knowledge mobilization team at Atlas, we organized this whole webinar. We were able to create a lot of resources on neurofeedback, make it accessible to really a wide range of people, so including service providers, members of the community, veterans and family members, and academics as well. And from there, as we're kind of discussing about how we can work with other portfolios at Atlas to implement trainings on neurofeedback for service providers. Because that was, one of the main feedback we got from the webinar is, service providers were really excited about that, but how do we get training?
Right.
And that's another thing Atlas can help with, right? So it's such a unique ecosystem, I would say. And coming from a researcher perspective who, typically we're just at the university, I'm really, honestly, every day, I'm really grateful to be part of Atlas because it's bringing all of the key players to the table. And that's what's really important.
And just quickly, it must be really rewarding for you because you can observe in a shorter time your work making a difference.
Yeah.
So there's that opportunity.
One thing that I can tell you, like veterans expect us to train the community out there that's trying to help them, right? How do you make somebody better? I'm not going to go teach a bunch of doctors, but what I can do is teach you maybe the parameter and context of the experiences of the people we're working with. And my theory is, and why we built this place, is that makes you better and you make me better. And that was kind of the theory behind it in the end. And this is it just working, right?
Yeah.
To some degree, I do want to touch on one thing before we part ways is that back when you're talking about, hyper and hypo in terms of somebody reacting, if I'm the person that's reacting, and I'm reacting hyper, and this is my sister. What is she noticing about me that would be different from normal? Because she's not reading this graph and she can't interpret what you can. What would she see?
It depends. There's a lot of different areas of the brain that can show too much or too little activity. Could be things like, as I mentioned before, hypervigilance symptoms. It could be hyperarousal, nightmares. Could be, feeling angry even. The hypo are things more like emotional shutdown, feeling disconnected, those dissociative symptoms, so those out-of-body experiences or feeling disconnected from your body, as well as feeling like maybe, this situation isn't happening or it's a dream. And especially, those dissociative symptoms, those can also have significant impacts as the others, but particularly dissociation on interpersonal relationships. If someone's so emotionally shut down and disconnected, of course, that will affect interpersonal kind of dynamics, right? So those are some of the symptoms that are maybe associated with those changes in activation.
So what's exciting in the future? What's coming up in your work?
Yeah, so how much time do you got? We have a couple exciting projects, in the pipeline. We're expanding our neurofeedback work to look at the benefits of regulating specific areas of the brain and how that may lead to unique symptom changes in PTSD. So that's a clinical trial we're doing. We're also expanding our work to look at the effects of something called secondary traumatic stress symptoms. So this is through a process called vicarious traumatization. So really this study is looking at the effects of trauma not only on veterans, but family members. So we're using, again, neuroimaging methods to help expose these invisible wounds. And I think we're hoping actually this will be, again, Laryssa, I think you mentioned the word validating, right? And, by looking at these very, measurable biological changes to, validate these experiences that PTSD is not just affecting individuals. It can have far-reaching effects, particularly on family members.
It's something, you and I have had lots of conversations about this, Andrew, and it's something that I'm personally very curious about because, I've been with my spouse for a number of years and hopefully supported him well, sometimes better than others. But I find, I can almost see in myself, reflecting some of his behaviors. In certain places, I'm hypervigilant. I'm sitting with my back against a wall. All that type of stuff. And so I've always been curious.
Even get more protective than it needs to, right?
Yeah, absolutely.
And I've seen this in our community is, people get used to some of our triggers, then they get oversensitive to them, and they might even sense them when we're fine.
Yeah. So then, I've been wondering, okay, does that mean that there's changes in my brain as well? So that's an exciting study coming up. Thanks for sharing that.
Yeah, absolutely.
So I think one thing that I did want to ask is, in my community, I've seen a lot of veterans feel, I guess I'm going to say cynical or jaded about participating in research. They've been subjected or asked to participate in tons of research and might be hesitant to participate for a number of different reasons. Maybe they didn't feel it made a difference, or they were never looped in back to know what it was, or they didn't have an investment maybe in what they were participating in. So, I wanted to ask you, why should veterans and families participate in research?
Our experience has been that actually, some of our studies are it's a big ask for people, right? Especially, time, if there's some exposure piece, that can be for sure uncomfortable for people, right? And some of our studies are quite long or complex, so it is a big ask of people. But we've actually found that although people may be even discouraged with their treatment kind of trajectory so far kind of thing, but they feel very committed to participating in research because I think a lot of members of the community know how much these studies can impact the treatment approach of trauma and related disorders and how we better understand those disorders.
Yeah, just my observation, a lot of the people that I know are, and I don't want to paint the broad brush, but many people I know who served there's an altruistic component to that. They're choosing to serve to help others, really, essentially. And
training, right, is experimentation. You're trying, maybe not trying out a new scientific technique, but you're certainly trying a tactical one. And so the vast majority of soldiers' lives is not operational. It's getting ready to be operational. We've been experimented on. It's not a good feeling, right? And even we find that is, we really have to explain to people what we're trying to do. Not only that we actually see that there's something we could possibly do with it on the other end. And even I look at a lot of the stuff out there and I can't see what people expect that they're going to do with it. But I can see that here.
Yeah, I think that's where it's helpful is to know that there's a potential positive outcome. And it might not be for you, for example, as a retired warrant officer, but it might be make a difference for private bloggings.
One thing we do actually in our studies is we reach out to participants actually throughout the project, letting them know interim or preliminary results, which we've received a lot of positive feedback from that actually of, thank you for participating. Thank you for all your time. And this is what we're learning and this is what we're doing with it as well. And we share, for presenting at a meeting or a community engagement type of session or a conference, we always let people know, but we share kind of those findings throughout the project. And I think that's really, important for people.
Thank you for doing that. It's important.
So before we part ways today, I want to thank you. And specifically, you could have taken your talents anywhere. You took them here and you're working for what I consider to be my friends. So it's a big deal. For any other institutes that are listening, you can't have them. We got them first. Go away. But this has been an exciting episode for us of Mind Beyond the Mission, being joined by our colleague, Dr. Andrew Nicholson. Thanks for joining us.
Thanks, Andrew.
Thank you.
We hope you enjoyed this episode of Mind Beyond the Mission.
If this conversation resonated with you or helped you in any way, I encourage you to subscribe to Mind Beyond the Mission wherever you listen to your podcasts, so you'll be the first to know when our next episode comes out.
And if you know someone who might relate to what we've shared or could find it helpful, please feel free to send it their way. We're all on the same team.
Plus, we'd love to hear what other topics you'd be interested in us exploring in future episodes. Brian and I have a lot of ideas and subjects we plan to dive into, but you, the listener, have probably experienced or thought of topics that haven't crossed our minds yet.
Please reach out if this is the case. We're on social media at Atlas Veterans CA on most platforms, so please feel free to tweet at us, send us a message, or leave a review on this episode, and let us know what else you'd like to hear us talk about.
Brian, it's always a pleasure having these important conversations with you. Looking forward to next time.
You bet, Laryssa. Take it easy.